So let's start with our first speaker, Anthony Hall, Director of Insights, Assurance and Governance at HC1. Anthony, could you please outline the vision behind implementing Radar Healthcare and Nourish Care to give oversight of risk, quality and compliance? And could you also elaborate on how interoperability has played a crucial role in establishing a central governance structure and the resulting impact on residents? Thanks, Anthony.
Yeah. Good morning, Sam, and good morning, everybody. And thank you for joining us this morning. And as Sam said at the beginning, I think this is quite a major moment in how we look at digital care within social care. And hopefully, in the few moments that I speak, you might get the sense that why it's really important for our future as part of an integrated care system outside of our social care environment. But first of all, let me just take a few moments to explain the kind of HC1 journey around digital and why this integration is really important for us. So in terms of setting a better resident outcome and giving all of our 21,000 colleagues the real tools that they need to deliver better quality care for residents, it's really important to give the right systems to people. So we started on our digital journey about 3 years ago, I think, in the middle of COVID, and implementing an email solution, which we did with a company called Medicare. And the next piece of that jigsaw and the real kind of fundamental spine to this whole jigsaw was our partnership with Radar Healthcare. And we've been partnering with Radar now for quite some time to deliver the solution for us. And later on in this webinar, you'll hear about how we implemented Radar through our 280 odd homes. Radar offers us an incredible solution around event management and incident, or better known to many of us as incident management, but also audits, etc., and our whole kind of way that we manage our business. I always kind of, the organizational brain of our business is kept within Radar Healthcare. And whilst Radar offered us a solution to record things much better, it's a much better format than our previous solution, and it's much easier to use. Fundamental to the approach with Radar was to create a learning approach so that we learn from every single thing we did. Anything that went wrong, nearly went wrong, or had the potential to go wrong. Anything from our audits, not just about passing and failing audits, but actually what's the true learning from an audit. All of that was embodied with how we worked in partnership with Radar Healthcare to build the system for us. So now every single thing that goes into that, we have a learning outcome and we have a learning dashboard, and we've truly learned. The next piece of the jigsaw then was to create an electronic care plan and move away from our paper-based care plans, and therefore we partnership with Nourish Care. And this is great because for all of you that are on this call, probably you don't need me to tell you the benefits of electronic care planning in terms of oversight, ease of use, etc., etc. But the real power of all of this is to join it together. Because how powerful is it that if our carers in their hand not only have an electronic care plan and a timeline of everything that's happened to a resident that day or that week, but they also have all the learning from all the things that have gone wrong or had the potential to go wrong, and all the things that went well across the whole of the HC1 estate of those 280 homes, looking after nearly 16,000 residents, all in their hand, and also seeing the medicines records at the same time. That's incredibly powerful. And the ability for a carer to walk into a room and may have seen somebody who's fallen, for example, and is lying on the floor, immediately giving them the attention they need to make sure they're safe and well, but also being able to see why that might have happened in their hand. And it may be that their medicines haven't been administered on time. It may be that they've had a blood pressure drop in the last couple of days that we need to be mindful of. It may be a number of reasons, but it's all in their hand and they can all see it. And once they've made that person well and safe, that carer can report that incident immediately through the care plan. It goes through to Radar without them even knowing. And the Radar goes through its workflows to create the investigation and, more importantly, the learning outcome, and then writes it back to the care plan. So the next person who goes in that room and looks after that person knows what the learning was from his previous fall. And that's the power of this integration. And it's not just about joining systems together. It's to give every single carer an holistic view of every resident and everything that's going on with them. And that's And then finally on that point, if I may, that what's really important is then if you get that right and that integration right internally, you can start to connect this to our external partners. So we not just have GP Connect to look up GP information, but actually connect with primary care through System 1 and EMIS, connect with secondary care systems, so we can have joint oversight of care plans and share the care of people in our homes. And that's the next step of this digital journey. So I'm absolutely delighted with this, because I think the power that we've created in people's hands is the most important thing, which without doubt will improve resident care.
That's great, Anthony. Thanks so much for that. I think we can all sort of see how it's, you know, resident outcomes that are driving this innovation, and just yeah, what a difference that's going to make. So yeah, thanks very much. We're next going to go to Rian Bulmer, Chief Partnership Officer at Radar Healthcare. Rian, could you explain a little bit about the value in the Radar Healthcare API strategy, and why they partner with industry leaders, and what benefits of integrating are?
Yeah, absolutely. Thank you for having me on the webinar, and great to hear from you as always, Anthony. The strategy with HC1 and with Nourish fits into our wider API programme of work, whereby we've built an API adapter that sits at the front end of our system and our wireframe, and is able to take data in and automate an event from loads of different sources, whether that be devices. So we have use cases of taking data from fridge monitors that automatically come via the API adapter, launch an event, and then trigger the relevant workflow within Radar, through to EPR systems, as Anthony talks about, in wider healthcare settings, whereby we might take a meds error trigger and automate an event via the API adapter into Radar and the relevant workflow. And this use case here, specifically with Nourish, is all about leveraging the power of what's within the care planning system and taking that information from a care planning system through the API adapter, launching an event, launching the relevant workflow, and taking that all through to Radar. And like Anthony said, closing off the loop and writing the outcome back. So that piece of technology is boundless in terms of the ways it can be used, the use cases of it, the power that it opens up right across health and social care. But for me, the most exciting part of this is this started in social care. This is the first live launch of something that we're doing across all the different elements within the UK, of really showing the power of joining up systems and not working in silos, but actually showing a seamless journey for all of our users and all of our frontline teams. Because technology is great, but it's only good if it makes it easy for frontline users to use it. And that's why we've invested so much time and effort into this specific adapter, and why it's so brilliant to see this brought to life today.
Thanks, Ryan. Yeah, it's definitely really interesting to sort of see the significance of the integration and the interoperability, and the importance of choosing software systems that sort of meet, you know, a specific organization's needs. Because obviously, as we know, there's not a one-size-fits-all approach. So recognizing that there's no universal solution is important to sort of shaping how an organization works, and I'm sure this is going to be a big topic and like focal point moving forward, you know, over the next few years. So thank you very much. So next, Denise Tack from Nourish Care is here to talk about the impact and benefits that the Radar Healthcare and Nourish Care integration can mean to those working in care. So thank you, Denise.
Thank you. Yeah, so I mean, I'll start by saying, so at Nourish, our partnership program really has open arms for any technology supplier in the sector that's credible and is willing to work with us to break down, as Rian said, some of the silos of data and working that we see across the whole of social care, really. So I think there's a legacy misconception around social care digital that says it's all kind of a wild west of siloed data, systems that don't talk to each other. And then care providers themselves start to think, okay, well, I'll work with lots of different suppliers, and they accept this kind of given rule that these systems won't talk to each other. But at Nourish, what we're trying to do is break all of that down and help care providers to use the right system for the right action, and to be able to see everything where you need to see it. So as Anthony alluded to, that kind of care plan in your pocket, being able to see everything that you need to see, but also others in the organisation having their own versions of tools that they can see what they need to see. So for us, that's really important at Nourish, and Radar are a great partner to work with, because one of the other things that's important with any partnership program is being able to work with others, right? It's not just about the technologies clicking together. It's about care providers being able to get us as suppliers around a table, which we do with HC1 quite regularly, to talk about what the real life challenges are around that technology. So working with the HC1 team and Radar, we've been able to unlock some really good use cases for this integration. And I think that's really important for any care providers watching this webinar today, is to really think about the suppliers you're working with and how you can get them to come together, because I think that's how we make impact on the sector. It's connecting things together, but it's connecting people together as well, which obviously is what we're all here to do anyway. So yeah, that's from our perspective really, really important.
Oh, great. Thanks, Denise. Yeah, really insightful, and leads us nicely into our final speaker, Chris Pearson, Digital Care Manager at HC1. Chris, if you could explain a little bit more about the process of implementing Radar Healthcare and Nourish Care, and sort of like the lessons that you've learned from that, and the impact it's had on the teams at HC1. So if you could just sort of start at the beginning of the journey, and like, where did you start when tackling the project of integrating the two, Radar and Nourish, into HC1's operation?
Thank you, and thank you for having me on this morning. So, well, the first thing we had to do was get Radar live in the organization. I joined the Radar project last year, and once we had a kind of build ready and the system set up, we quickly moved into our kind of real world testing, where we partnered with our chosen homes to get feedback on the system, on making sure that we'd set it up correctly and how best to roll the system out. And through that, the most suitable approach we learned was an individual kind of virtual 2-hour training session for each home that would give each home a safe space to learn how to use the system, where, with it being virtual, we could really make sure that the user kind of understood everything that was being explained, and they could ask any questions in that kind of safe environment. That approach was going to be hard work, because there was a team of 3 trainers, including myself, but we were sure that was the correct method to use. So we began rolling out Radar to our estate of around 280 homes, as Anthony says, at the beginning of October 2023, and we completed that in December of 2023. And touch wood, that's continued to be okay so far. And once we'd completed that, we had Nourish live in a number of our sites, including some of our real world testing sites. So we then moved to look at how the integration was going to work for our colleagues. And the place we had to start was from a kind of user perspective. We always had integration on the roadmap. We knew it was coming, but we didn't always kind of know how the nuts and bolts of it would work. And basically, in our homes, we had the Radar system set up with a web form, like many users who use Radar, where our colleagues find a device in the home computer and would log the events. And then what they would do is go through to the kind of logged in part of the Radar system, where they'd complete their workflows and everything like that. That's replaced in the Nourish system with an event on the timeline and interaction for the residents. So you go into the care plan, you go into the timeline for that resident, and that's where you would log the event, and then that triggers through to the Radar system. So that bit we didn't have much to kind of do in terms of, we just had to kind of show the users the new process, which was obviously an advantage, because suddenly you've got this device in your pocket rather than have to go off and find one. But where we had a challenge was that this kind of single event type that the Nourish system used had to be mapped to how we used Radar. And like many Radar users, we had multiple events. So we had to look at the key pieces of data that we were capturing in the single event and kind of move them into the investigation stage. So we worked with our product team within the organization to kind of to move all those questions and just kind of align the two systems, and then make sure that it all worked within our analytics, and Radar kind of supported us to do that. So once that was called up running, we did a period of testing within the staging systems before switching it on, and then doing the same thing with the real world testing, working with our users to kind of see what works. and kind of learn about the process before we look to roll it out further.
Okay, great, Chris. Thanks for that. So, yeah, and with that vision and plan, what did you learn from the real world testing? And is that something that you would recommend to others?
Definitely. I mean, you could argue that real world testing is just another name for a pilot, but we wanted to feel more like a partnership with those who we were working at. We didn't want this kind of going into to just kind of rolling out to a home and kind of saying, fill in a feedback form at the end of it, see what it's like. We wanted them to be able to really shape what we'd put together, even if that was kind of ringing us at 7 o'clock at night just to tell us they hate it and we had to do some changes. So we really kind of wanted to make it different from a pilot, and we learned loads from it, especially when it came to kind of rolling out the radar system. Like I say, we did the individual training sessions for each home, and that was all from the real world testing. We found that when we were engaging with the users and doing some training sessions and things, you had the really confident people in the room would get kind of everything they wanted, and those who were maybe quieter didn't get the same out of those sessions. So that's why we kind of created that safe space, and we wouldn't have learned that without doing the real world testing. So it just made sense that we then took that approach to the integration, again, just to tell us how things work and make those tweaks, and just kind of create that safe space for the home managers where they actually felt that they could influence the product rather than just receive a kind of standard pilot before we went live.
Yeah, of course. And yeah, so you may have touched on this a little bit just there, but I wonder sort of what impact the integration has had on users within HC1 and how the different roles within HC1 sort of benefited from it.
So one of the first things that we found was when we moved a lot of the data capture kind of steps into the investigation part of the process, we got really great feedback about that. So initially we would ask questions in the first forms, like what was the type of fall and that kind of thing, and that moved into the manager's investigation step, and they really loved that because that meant that with their investigation they would answer those questions rather than sometimes having to go back and tweak them. So that was something that we weren't expecting, but we did find really worked. And the main bits, again, we've already kind of touched on it, but was the fact that you don't have to no longer go and find a computer. So you don't have to go off down the corridor to find out where the computer is to put that on. You can just simply react very quickly to take the device out, log that incident. It's in the resident's timeline, and that was a massive win for our homes. The other part of it is just actually making sure that the care plan and the incident management systems aren't sitting in silo. So previously, leading up to that, you would put an event on Radar, you would log it and everything, and then you'd have to go into the care planning system to then make sure that there was something in there to note that that event had happened. Now the two things are kind of completely linked up. The event that's in the Nourish system in your care plan is exactly the same as the event that's in the Radar system in your incident management. And then at the end, you've got that right back to kind of say that the home manager investigated and put any notes to update. So it just kind of completes that circle rather than the person having to duplicate the work, which kind of currently was currently happening before the integration.
Yeah, it's really exciting to be able to sort of get to see the pathway that HC1 and Radar and Nourish are on, and like how you've sort of made all of that work. So following on from that, what would be your biggest piece of advice for those beginning with Radar and Nourish or any other care planning provider?
So from the integration point of view, my biggest piece of advice would be to start the conversations early. If you are thinking about this, if you may be in the process of building with Radar or implementing Nourish, have a conversation with Radar and Nourish. Have a look at that, the integration kind of form and how it works, just so you can kind of align yourself, especially like I say, if you're pre-rollout with the integration, even if you're not going to switch it on day one. Kind of see what tweaks you may have to make just so you're prepared for it. If you're a provider that's already kind of rolled out one of the systems, be it Nourish or be it Radar, again, start those conversations with the suppliers nice and early so you can start to look at any changes that you have to make. It can seem daunting, but you know, we did it, and it was quite easy with that support. But you know, give yourself the time, and like I say, yeah, start those conversations early.
Thanks very much, Chris. That was yeah, just really insightful. Yeah, and I'm sure it'll be really useful for everyone watching today as well. So I think it's clear to see that the journey that you've been on, yeah, we're just really excited to sort of watch that as it develops. And just to end the webinar, we'll now be heading back over to our speakers to reiterate the key takeaways. So if Anthony, Rian, Denise, and Chris, I'd just like you all just to jump in and tell me that your sort of key takeaways from this.
So if I have to kick off, I think what's really important for me is that all, you know, when we're looking at digital systems, is that I mentioned earlier about the power of bringing them together. You've got to think about this as a resident journey. Okay, so all of our residents are actually part of a bigger journey. They're part of all of our residents actually are a GP's patient, and many of our residents are also a secondary care patient or patients of other people in the healthcare system. So in all of bringing these systems together and how you piece this together as a resident, you've got to think about how all this fits together as a resident journey. And unless you really understand the resident journey, you won't understand how to bring these systems together. And my big takeaway is that the resident journey isn't just our journey, as I mentioned, it's a bigger journey. And if you can think of that, you can then see how all the interactions around a person, from secondary care, primary care, etc., bring all that information round into a care plan and out of a care plan again. And then how Radar can enhance us about the learning from the auditing, from the events analysis, all the wonderful analytics that come out of Radar Healthcare can help us build a better active care planning. So, and I think if you can understand in that whole resident journey, then you're on to a winner. And that would be my big takeaway, is plan your resident journey externally and internally, then plan how you want to bring these systems together to enhance that resident journey. Then you will get the resident outcome. Because ultimately, if you don't focus on the resident outcome, there's absolutely no point in doing this, because that's the only thing that matters. Thank you.
And great. Rian, do you want to go next?
Yeah, thank you. I think for me, the technology is great. Technology exists. There's loads of tech, you know, there's lots of tech to take advantage of. There's AI, there's all kinds of things that you can do from a technical perspective. The key thing is then linking up the tech partners. So Denise and I work really closely together. We've worked closely together for the last year on this, and that's brilliant. And getting the tech partners talking to each other gets you so far down the journey. But the most important thing is having partnership with the likes of HC1, with the customers, and with the different stakeholders that are represented from that customer. So from Anthony to Chris to frontline users to divisional leads, getting all those different voices involved in the story helps make something that really works for the sector, not just something that's tech for the sake of tech. And that's what we're really keen on, you know, taking the best of what's out there, but making sure it's operational and adds real advantages and isn't just something that's forced upon frontline teams. So for me, the biggest takeaway is getting all the stakeholders around the table. And I know Anthony and Denise talk a lot about this, from taking this one use case to how we widen that across the whole sector and widen that across ICB footprints, across all elements of health and social care, taking social care's done as that real kind of first mover in this kind of use of technology, how we widen that out across the whole estate. So absolutely getting the right people around the table. Tech's the secondary to it, in my opinion.
Thanks, Rian. And Denise, would you like to go next?
Yeah, sure. I mean, I'd obviously echo everything that Rian has just said, as well as what Anthony said as well. I think for me, listening to the group again, reflecting what's just been said, I think it's really interesting what Chris has been talking about, which is really looking at pilots from a different point of view. I talked about some of the misconceptions that surround adult social care and technology, and death by pilot is quite a recognised thing. There's lots of pilots and they seem to go nowhere. And what do we mean? Are we testing the technology? Well, we're not, are we? And I think Chris articulated that really well, that HC1 went into this trusting the digital partners that they selected because they went through such a robust process. What they were really doing was, through testing or piloting, was really testing the digital readiness and maturity of the different parts of the HC1 organisation, co-designing that process. And I think that, if I was a provider watching this today, that's the thing that I probably take away is, do that baseline assessment of your organisation, follow what Chris and the team have done, and then work with us as suppliers and let us help you with that co-design. So yeah, I think that's what I probably take away from this. It's very much about that. How do we all work together as partners?
Thanks, Denise. And lastly, Chris, do you want to jump in?
Yeah, I'm just getting echo what everyone else says, and our kind of key takeaways is how exciting this is, but that we just kind of need to keep the end kind of colleagues in mind, those people who are using it day to day, as well as the residents who are going to benefit from the outcomes, and just making sure that we're doing this from a point of view of making their lives easier and making the information that they're capturing more streamlined and preventing that kind of duplication. I think this is the key to doing it, making sure that systems aren't just sitting in silo, and ultimately if we can give them the time back without them having to do the duplication, and even as much as going down to find a computer that's available, that's going to give them time back to spend more time with the residents and more time actually caring rather than documenting.
Oh, brilliant. Thanks everyone for that. So that's sort of the end of this part of the webinar now. Thanks so much everyone for joining us. We are now opening the Q&A. So if you've got any questions, everybody attending, please do put them in the chat box, and we're going to try and get through as many as we can now. So yeah, I'll just I'll keep an eye, and hopefully some pop up soon.
There's some in the Q&A box.
Oh yes, there are indeed. Okay, so let's start with let me see. So if we could go to Mark, could you tell us maybe how this integration works in real life? Could we start with that, please? Oh yeah, I think you're on mute, Mark.
Thank you very much. Thanks, Sam. Yeah, I suppose it was touched upon a little bit by Anthony, by all the speakers really, as we sort of came through this. The whole idea of this integration piece is to avoid duplication of work for frontline users, and also to ensure that that resident journey that Anthony mentioned is managed in the best way possible. What we want to make sure is that people on the front line aren't asked to go into two systems to report exactly the same information, because that's time back that they can be spent actually spending time with the people that they're supporting. So realistically, what would happen is someone on the front line, if an individual service user, resident, person that we support is involved in an accident or an incident, they would go into the Nourish platform, go and actually put that on as what we call a new interaction on that particular individual, and to choose the radar incident. They'll put all the relevant pieces in. One thing to bear in mind is this is a standardized form to make sure that this can work across multiple organizations. That will include the carer, it will include the client that we're looking after, and it will include what's happened to that individual in that incident. That's then passed into the Radar platform, and that starts and triggers what we call a workflow within Radar Healthcare, which is where individuals around the organization will be asked to sort of investigate what's happened, look at what could have been done differently, maybe put actions in place, learn lessons around this, which again, Anthony was talking about earlier. That's the key part of doing this, is to understand not just what's happening, but why things are happening, and then how we can put sort of actions or mitigations and controls in place to make sure that they happen less frequently. That then's passed back to the Nourish platform, which closes the loop down. So basically, you've got that loop in. Incident will happen, comes into Radar, you'll go through and work out why and what and where. Then it passes the outcomes back that looks at the lessons learned piece, and then that closes the loop between the two. And you'll be able to see that on both the patient or the the residents' information within the Nourish platform, and also as an event, and be able to pull that data into the Radar platform as well. So it's a really nice, clean way of individuals being able to report what's happening, and then that journey happens that goes between the Radar system and the Nourish systems. Hopefully that sort of answers that question.
Brilliant, Mark. Thank you. So I'm just gonna go through the questions that we've been given. If whoever feels the question is most relevant to them, if you just want to jump in. So the first one we've got is, how do you manage events or incidents that are not linked to a person that a care home is supporting? So by which I think they mean a staff member or visitor who's had an incident.
I can answer that one. So at present, they would be the more of the incidents and events that that the home managers kind of log for HC1. So they will come in and get logged directly on the system. So we have it kind of dual feeding. So if you have a resident specific, you would launch that from the Nourish system. If you had something that might be a colleague who perhaps gets injured or something like that, then you do that through the Radar system, and that seems to work quite nicely for our users, because of the way that we do that in HC1 anyway. I hope that kind of answers it. And you can also have forms available. So in Radar, obviously, we know we've got the web form. You can kind of tailor that so you don't have the resident specific ones as part of those web forms, but you do have the ability to log something like a colleague incident and have those separately.
Okay, that's great. And so what was the biggest hurdle you guys faced when integrating resident data?
I think the biggest hurdle we had was moving all those questions. That was the bit where we initially kind of looked at it and thought, right, there's a single form. It doesn't match kind of how we've built things, and that was the part where we had to start looking at capturing the type of fall. We would capture it in the web form. All of a sudden, we couldn't capture that kind of detail of information, so we had to move it. But like I say, that worked out quite nicely in the end, because our managers liked the fact that they could read the narrative from the form in Nourish and then complete those questions as part of their investigation. And the kind of worry that we had was then how that would go through to the analytics, because we captured it in one place and now we're going to capture it somewhere else. But Radar managed to kind of just be able to align that for us and make sure it was counting from those two areas. So yeah, that was our kind of biggest challenge, the biggest hurdle, but it came out all right in the end.
Can I just add something to that, Chris?
Yeah.
Right. From the viewpoint of people listening, there's probably 2 or 3 ways that we'd recommend looking at it. In an ideal world, if it's a brand new kind of form, from the very beginning of a journey, we can match the forms, Radar and Nourish, and we just roll out that form right from the start. If it's a retrospective fit, which is what we did with HC1, it's that having to look at the forms and merge and reconfigure them as best possible. There is an option to speak to both ourselves and Nourish about completely bespoke forms and how that might look moving forward. But our kind of recommendation is we did this piece of work with HC1 to get what we would consider that industry standard. And that's not to say we can't deviate from it, but again, it's that kind of starting somewhere piece that we wanted to do. So whilst it was your biggest hurdle, it's probably been the biggest impact for the sector, because we've got that form now that kind of represents HC1's opinion on how that might work. So thank you guys for that.
Sorry, there's just one last little bit that I'd like to add, if that's okay, which is, and again, this is probably for organisations on a larger scale, a little bit like HC1, which is where we're sort of looking at the rollout of this and making sure that there's data consistency between the Nourish systems and non-Nourish systems and things like that. So it's something to bear in mind when you start to plan this process. But as Ryan alluded to and Chris alluded to, Nourish and ourselves are there to help that process and to sort of help you go through that and plan that as part of your journey.
Great, thank you everyone for that. And kind of following on there from you, Mark, saying that it was sort of that element was maybe more catered to the larger groups. We've got a question here that is Radar recommended for smaller organizations? And then it suggests maybe 1 to 3 homes. Yeah,
I'll pick that up if you like. And we have probably the majority of our customers fall into that bracket, if I'm brutally honest. purely sort of, if we look at our numbers, we've got around about sort of 250 customers, and probably about 150 of them fit into that bracket. That's because every home is interested in sort of making sure that they deliver the best possible experience to the people they support, and that is what Radar helps you do. The whole idea of Radar is to look at when incidents are happening, to understand why they're happening, and then to put controls in place to stop it from happening. It's what Anthony talked about. It's making sure that we can do the best we possibly can to ensure quality of care to the people we support, and that's Radar's vision and goal. And I'm sure that that's Nourish as well. Is not just to sort of look at this from a Radar perspective, but from a Nourish perspective. So long as we're looking at making sure that that journey is planned, it shouldn't matter what size the home is or the group is. It's all about the outcomes that you want to drive. That's where we come to, really.
Oh, great. Thank you for that. And I'm not sure who'll pick this one up, but it's an interesting one. How has the CQC received these changes? And how is it sort of like, how are they looking at it during inspections?
For you, Anthony, you're on mute.
Apologies, schoolboy error. I'll pick that one up because I'm the nominating individual for CQC, so it kind of fits with me. And I think first of all, I would say to any provider that's kind of doing this work, talk to CQC. So we have a principle with CQC, and we have 238 homes registered with CQC in England. So it's really important for us that anything we do is going to be accepted by CQC, and accepted by CQC at a national level. So we co-produce everything in CQC. So everything we do is gone through CQC, and we know they're going to be happy with it. And that's the work that we do in Nourish on care planning, the work we've done with Radar, the work we do with medicines, and also the work about how we bring it together. What I would say to providers is that, and particularly with the single assessment framework now being implemented, CQC is all about learning. So it's all about moving away from checkbox auditing, checkbox compliance, to actually what is the outcome for a resident, and what have you learned, and how are you going to put it right and make sure it never happens again. And it doesn't matter whether you're one home or 200 and odd homes, the learning principle remains true. And if you can do that, you are absolutely going to nail well led. And you're also going to cause, solve all your safety issues. So CQC love it, and they love this approach. They love the approach that we can extract a learning outcome for every single incident event in Radar. They love the approach that we've got a fantastic holistic care plan in Nourish. And they absolutely love the approach that we can bring all that together in one place, so that our care staff have all the information they need, but actually have all the outcomes from the learning from anything that may have gone well or not so well. It's an absolutely win-win for everybody, and we're finding that CQC have received it incredibly well.
Cheers, Anthony. Thank you. And obviously, yeah. So the next question we've got is somebody saying that Anthony mentioned falls quite a few times, and they want to know if falls prevention or detection is sort of on the cards. And I guess that could apply to the collaboration between all of you guys, or if any of you individually are looking at that.
As soon as I mention my name, Sam, I'll just pick it up quickly before others. But so I'm obsessed with falls, because falls for me are things that we can really do things about. And if you think about, Radar gives us an incredible insight into falls, and not just falls, but the repetition of falls and the causation for that, which is incredible. And then you overlay that with the information that's in the active care plan from Nourish about, for example, how much people have had to eat and drink each day, which can be a cause of fall, for example, or anything else that's going on in their care that can cause that fall. So bringing those two things together, the analytics of why falls have happened, why repeated falls have happened, but actually what is happening to a resident that day. Have they had the meds on time? Have they had the right medicines? Have they had enough to eat? Have they had enough to drink? Is there something else going on with their blood pressure? All that kind of stuff brings that into one place. Just on the detection point, all of these systems can link to all sorts of detection software. And as providers, you will all be inundated by falls protection initiatives and devices they can hook on to all these systems through the API interface that Rian was talking about earlier. But actually step back, because fall detection already implies that the person is about to fall or they've already had a fall. The power of these systems, the power of the integration, is to learn why people fall, to stop it happening in the first place. So actually, whilst detection systems are amazing, and some of them really are fantastic, you know, you're at the point of somebody about to fall or they already have. Step back and use these systems to truly understand and learn how to stop people falling.
And just to add to that, and I know they'll be really keen on this as well, that is not about restriction of users moving around at all. This is nothing to do with that. It's all to understand, you know, where you've got repeat falls, is there something that needs to be catered into that resident's care plan? Do we have to look at how they're being treated to make sure that we cater the best possible care we can based on where they are at that particular time in their journey? So this is not about restriction of movement. This is about making sure that we know why things are happening. And as Anthony quite rightly says, make sure that we then deliver the care that supports their journey to make sure that they are working living in the best environment they possibly can do. And actually, that's where Nourish and Radar overlap absolutely perfectly. Because Radar will give you the underlying factors as to why they're happening. Nourish is then the care planning system that lets you put that in place for your care planning.
Okay, brilliant. And I think, Mark, we've got another one for you here. So it says, from the experience with HC1, what factors impact on the duration required to integrate?
Oh, many number of things. I suppose what we've got to sort of think about is, where is that particular organisation in their journey? So are they existing Nourish clients, for example? Are they existing Radar clients? Are they called Greenfield, or so are they new to both? So if you think about sort of an existing Nourish client plugging Radar into there may be some changes into looking at how that workflow is going to work practically, because they'll be used to maybe collecting some of that information in Nourish initially, and how we then move them onto that sort of singular form and move across that into Radar, vice versa. If they're used to collating that information in Radar and then bringing Nourish on, you'll have exactly the same journey backwards. Probably the easiest is if you're actually new to both, and actually then we can start to look at how that works practically in both areas. So there's obviously existing users we need to look at. There's obviously size of organization as well. You know, if we take sort of the HC1 approach, this is a pilot scheme that's going to be rolled about across the organization, which means that there will be at some point 2 processes working at the same time, which means there's going to be like 2 data sets. So we have to be aware of how that type of thing can potentially sort of, if not elongate the process, at least make the waters a little muddier initially. So there's lots of things that could potentially sort of elongate the process of getting this up and running. That being said, you know, you can also get this up and running in a few days as well. You know, this is a standardized process. We just make sure that you've got the testing process that sits behind it as well, which could potentially elongate. We just make sure that this is sort of planned and rolled out properly. So it will depend on the resource that they've got available at their side, the resource we can support with that, and just making sure that we're meeting those timescales that the organisation has set down. So we'll work to try and ensure that from a Nourish perspective and a Radar perspective, that we're always trying to sort of meet those endpoints or those milestones that customers want. But there will be quite a lot of planning that goes along behind that. So hopefully that answers it. There's a multitude of things that can potentially sort of look at the sort of the time to implement, and unfortunately you can't just go 2 weeks, 10 weeks, 18. It's sort of a little bit case by case, I'm afraid.
Yeah, of course, that makes perfect sense. And I think we're going to head to our last question now. We've just got one more, and I think, Anthony, it might be best suited to you. Why did you implement Radar Healthcare first and then Nourish?
No sort of particular reason, other than the fact that we had an immediate need to replace our existing incident management system, and I guess that was just the first part of the journey, and I sense that, and I think if you step back, care planning, as we know, is absolutely fundamental to everything we do. Okay, but if you think about, you have to, in this digital journey, you have to create a spine, and a spine is then the things that you hang around that spine. And for me, if you can't find a repository for the incidents and the auditing that goes on in the organization to understand the causation behind things and the learning opportunities, then potentially you won't get care planning right, because the care planning has to learn from all those things. So if you think of Radar being the spine, the next stage is then to bring the care planning online. And I guess for us, that was our thinking about when we needed to replace our incident management system. What do we do first? Because we knew we needed to digitalize the care plan, but we also needed to do this. And I wanted to create that spine that allows us to do that, to move on to the next stage, because it's about building the platform and the foundation for a care planning system that is truly based on the learning outcomes coming out of Radar.
Brilliant. Right. Thank you, everybody, so much for your time today. That's the end of the webinar, unfortunately. If anyone needs anything further, any people watching, if you need anything else, please just get in touch with Radar. They'll be able to answer more questions on this. And yeah, just for the last time, I'd just like to say thank you to everybody and goodbye.